Welcome to Passionate World Talk Radio. Educate, enlighten, entertain.
Passionate World Talk Radio. At this time, I'd like to thank Lillian Caldwell. She is the CEO of Passionate World Talk Radio, and Jeannie White, our station manager, that does everything for us. And again, thank you for both of this. Jeannie lets us tell our stories, and she's very patient with us. So thank you, Jeannie White. I'd like to introduce, at this time, Amy Smith. Amy Smith is a nurse. She works full-time in a hospital ER. And I'm going to ask her to give us a few updates on how it is working with the COVID patients in the emergency room. Welcome, Amy.
Thank you, Sheila. Like Sheila said, my name is Amy Smith, and I am a nurse here. I work down on the South Shore area, and COVID is still around. I know for us in the emergency room where I work, our numbers are still there, but at a manageable level. It seems that the disease has become more flu-like across the board with the patients that we're seeing. You know, if you have an underlying condition, of course, your symptoms are going to be much worse. But the last surge we had about a month ago, although we saw our numbers rise to almost 60 patients in a house, they weren't on the critical care units. They were on our med-surg tele units requiring oxygen support and breathing treatments, but not intubation and BiPAP.
Wow, that is good. So do you think this is all around the city and our state?
Well, I mean, the virus itself is still out there. I think people are learning to manage their symptoms and recognize in themselves when they don't feel well. You know, I think we still have a grand population of asymptomatic disease. But if you talk to people, they'll say, I had a day where I just felt crappy. And I think more people are listening to that and maybe using that as a cue to really hone in on their social distancing guidelines and making sure they keep themselves safe so the spread maybe is being mitigated.
Well, that sounds a little positive compared to even a few weeks ago when we spoke. Now, how about your PPE? You getting enough of that now?
In our facility, we've been fortunate that we've been able to get enough PPE and hang on to it. You know, we get a new mask now every second day. We were down to once a shift for masks, which was a far cry from once a week at the height of the pandemic a year ago.
And why is it a lack of masks? You don't have enough masks? Why do you?
I think there's a fear. There's a fear still that if an uptick happens, and because the virus is still very much across the country and across the world, there's that fear that they won't be able to get more when it's needed. Is the only thing I can think of to hang on to the masks at this point.
Well, I mean,
using it, manufacturers' guidelines were one and done.
Right, and that was like one and done after 3 patients or a sneeze.
Exactly, it was one and done after walking in and out of that room one time to treat that patient and give them their one medication or their one breathing treatment or whatever it is you need to go in for. You threw that mask away, leaving the room. It never left the room with you. It was dirty.
Right. And so are you saying that administration might be anxious that they can't get enough masks in? Do they need to go to a store and buy more, or?
Well, I don't know if it's still a manufacturing issue that the hospitals can't then obtain it. You know, I don't think it was ever a money issue. I think in this country we've forgiven things like that, but or allowed hospitals to obtain goods money wise, but is it available? And I think hospitals feel like maybe the manufacturers will make it not as available.
Well,
demand.
I think what happens is, I mean, for people that aren't in your position right now, I go to a store and they're selling masks all the time. Now, maybe they're not the right masks.
They're not the same masks, correct.
So you're talking about N95 masks.
Yes.
You're not talking about surgical.
Correct. And the difference in the use of the masks is really, the N95 protects me, the nurse, or protects the wearer. It does not protect the patient. So I actually wear the two masks. I've always got the N95 mask on so that I'm protected 100% in the emergency room where I don't know what the patient's coming in with.
Right.
But then I also wear a surgical mask over my N95 to protect my patients and my coworkers off chance I am carrying the virus and I have no symptoms. That mask gets changed throughout my shift as I go in and out of an exposed room to keep it clean.
So let me, in case somebody else hasn't understood exactly, you're saying when you're wearing an N95 mask, the patient isn't protected. You're protected.
Correct.
So you put the surgical mask on to protect your coworkers and the patients.
Correct.
But now how often can you get surgical masks?
Surgical masks, we have not had an issue obtaining surgical masks. We pass those out, even to our patients that arrive to the hospital in a cloth mask. We readily switch it out. We, ask them to change out their masks. So the surgical masks seem to be obtainable, and they have been. I don't remember there was a little less than a year ago in the height of COVID when it first started that surgical masks were starting to be very low and the cloth masks were being made. But I've not heard that they've been an issue since, at least not where I work.
Now, are you allowed to wear cloth masks? Like when the first started and you didn't have masks and then people made all these cloth masks for you?
Correct.
Can you wear those?
We can wear them over a surgical mask, but you have to have, for our staff, you have to have a surgical mask on at all times.
But you don't need the N95 on too?
In my department, from my personal safety standpoint, I do.
You do?
But at management standpoint, no, you don't. Management just believes that you have to have a surgical mask on at all times.
Well, that's good. I mean, that's just about everywhere.
It is.
I've gone into a hospital and they will give me a brand new surgical mask. Then I go into the doctor's appointment. They say, take that mask off. We're giving you this one. It's a new one. And it's like by the time I leave the hospital, I have 2, 3, 4 masks.
I'm surprised once you enter the facility, they don't just do one and done.
Nope. I'm going from one area to another area. And it's like, and anytime I've gone in, go, wow, I don't have to buy any more masks on my own. I should come here more often. It's just kind of mind-boggling as to how many times you need to change your mask, why you're changing it.
Well, so it sounds like wherever you've gone for your appointments, they've done a very safe thing for you and allowed
They certainly have
masks moving through. I caution you when you leave, keeping that mask that's now soiled on the outside because you walk through the facility, it should really be thrown away. They haven't given you anything to take home.
You're right. You're absolutely right. I should do that. But of course, I'm so excited that I got more masks. I would just shove them in your purse and never give it a second thought.
My mother was doing the same thing, and I said to her, Mom, here are some fresh masks. So one and done when you go out. She doesn't go out enough to make it an issue.
Right. So what about all the other equipment? How's that going for you?
We haven't had an issue, again, at my facility with gowns, and most people wear their own head coverings. Not everybody is still wearing them. I still do. Again, I work in a department where I don't know what's coming through the door, and the need to have to dress quickly to then address the patient, for me, is, maybe it's my age. It's too mind-boggling. I like to just be prepared.
Right. No, and plus it makes it easier all the way around.
It does.
You're already prepared. So what else is new that's going on? How's the staffing going?
I think staffing across the board in nursing, right? We're starting to see the fatigue. We're starting to see the drain of the 1 year of heightened emotion. And that is what we're starting to see come home with our nurses. You know, even in my own facility, the behavioral health population seems to be on the rise. More so this year for a younger population. It's a challenge. And so staff's having to deal with their kids at home and having to become teachers and still work their shift and give the emotional support that they need to give to their patients, all while being very drained in this last year. And it's starting to really show in people's emotions.
Is there any help as far as administration given the nurses or all healthcare workers self-care agendas, or the PTSD is going to fall because of all of these deaths, and you guys have been running for over a year.
We have I think it's called EAP. It's an employee assisted program. It's fully paid for by my place of employment. And I think in most places, and you can access them for behavioral health, not for yourself, for your family. You can also access them for financial assistance and those kinds of things. They really can be very helpful. And is a service, again, paid for by my employer. And I think most places have access to it. I'm not sure everybody does. But we do. It's just getting, again, nurses to take time to care for themselves.
And while you're working, do any of you talk about your own self-care? Do you even have the 3 minutes to talk about anything?
I think there are days that we do, right, that we can acknowledge, but it's so brief. And given the heightened awareness or the heightened state of this last year, it's not enough. I think typically that is how we all always decompressed. The 10 minutes as you were all leaving on shift, regrouping in the break room, kind of going over like, oh my goodness, what happened? And chatting and giving each other a pat on the back was well worth it. But we don't have that. They don't want us together in the break room, which I understand from a safety standpoint. You're all scurrying to leave because we've got children at home that you need to then log onto a computer and get them ready for their education. Or take that 10 minutes for yourself to have a cup of coffee or take a shower. Nobody's able to have any downtime. So losing those 10 minutes that we always had, even though that was all we got, is showing its detriment.
Wow. You have enough staff in the ER. You're not short-staffed at all.
We're not always short-staffed nurses-wise, but ancillary staff. I can't do my job without a secretary. I need techs and aides to help me support the care I need to give multiple patients.
Right.
So that's now, what we're finding. There's a lack of that kind of support.
And why is that? Why would, the ancillary staff, why isn't there enough there?
Well, I don't know. In this last year, healthcare hasn't been the place people have wanted to step into. And
Well, you've got a point there.
We're fighting for equipment. If we were fighting for equipment, guess who also wasn't getting equipment? Our support staff was fighting just as hard, if not harder, right? Because they weren't the ones going in the room. And so I think, they were being shuttled around the hospital, being used for transport of dead bodies when they were hired as an aide to sit and make sure an elderly patient doesn't fall out of bed. And now they're dealing with their own emotions with that. And we as healthcare workers see it in each other, but I don't know if, housekeeping knows how to support each other in that milieu. And yet they went through the same tragedy that we did.
What about respiratory? How are they making out?
Our respiratory therapy group went through, in the height of it last year, we had some travelers and they're exhausted. But they're such a small group, especially on the night shift. I think they keep largely to themselves, but they've got to be going through their own challenges.
Right. But it concerns me with everything that's going on. At least now that you're not wearing chemical-laced masks, that's a good thing.
Absolutely.
And has anybody mentioned trying to check everybody out for lung problems? Is there any even chatter about that?
There is nothing to chatter about that. My guess is that will be the knee-jerk reaction of 5 years from now when you start seeing the effects of some of these things.
And what about the PTSD, depression, suicide? Any of those? Anybody talking really a lot about that besides EAP?
I think nurses and nurse managers want you to self-advocate for yourself. And I think as nurses, that's where we have a challenge in doing that.
Oh, yes. I think that's one of our biggest problems, that we don't recognize the symptoms.
Yeah.
Because we kind of blow it off until something really happens. And so how do you think we could do better with this?
Well, I think it's giving, each other a moment. But unfortunately in healthcare, we don't have time.
Right.
So it's one of those luxuries we just don't have, and yet we so desperately need.
So you're still walking in at a certain hour, 11 o'clock, or maybe, and you're going home at 7, and you're lucky if you have 15 minutes during that time to yourself, to use the bathroom, to get a drink, to eat something.
Absolutely. I know for myself, so my children are grown. I don't have the at-home challenges of child care. But I co-chair my union at my facility. And so I try to be available for the other nurses.
And how are you doing there?
People are starting to reach out. They're starting to want to talk. But it's, again, finding the time to keep the conversation going. You start it, you've got 10 minutes, and then you move forward.
That must be extremely frustrating.
It can be. It can feel futile, but at least it's productive.
So they know who to come to. And so what would you offer somebody that's running into an issue through the union?
Well, I mean, it depends what the issue is. Sometimes you're just lending an ear.
Right.
With heightened emotions, everything seems so unjust.
Well, sometimes even without heightened emotions, it is unjust.
That is true. That's true.
I was trying to piece together something, and I was thinking about you and how you left your family because you were taking care of COVID patients. So you went and stayed with somebody else, left your husband and your son to fend for themselves, which was a good experience. And now that was unjust, but that was exactly what you had to do in order to keep your family safe.
Well,
Then you go into work and you don't have enough PPE, and you turn around and you don't have enough staff. I mean, how often? What else is going to happen?
Exactly.
What can tip you over the edge?
Well, I know for me, probably in the last month, I've noticed my fuse is shorter. It doesn't take as much to make you feel like I am all done.
Yeah, you're not the first person I've talked to about that. And they said, I used to be so understanding and I was so patient. And she said, I don't know what has happened to me and I'm afraid. And unbelievable. This woman could do anything. And now she's got to the point and she doesn't work full time. I believe you work full time, correct?
I do. I work 32 hours, yes.
Yeah. And so she has lost her patience. And it's just like everything she touches just isn't there like it used to be.
Mm-hmm. I find myself going to work and just hyper focusing on what am I there for? I'm there for my patients. I get my assignment, and as if I was a new nurse, I just focus on that, which can be a challenge in the emergency room. You do have to peer assist and help out in the department. It's not like you just have your one assignment, but I try to just hyper focus on that and help where I can.
And regularly, how many patients do you get in the emergency room?
Well, it depends. When the hospital is full and we've got holds, like admission holds. The other night I had 7 patients. And I fluctuated between 5 and 7 patients all night long because 4 of them that I received at the start of my shift were admissions.
Did they ever get transferred up to the floors?
I believe one may have. But there's not enough hospitalist staff sometimes to come and admit these patients and get them upstairs. Or we have physical beds, but not enough nurses on.
Right. At one time, I was working in the coronary care unit, and the coronary care unit only had 6 beds. That night, I had 6 transfers.
Wow.
I had to move them out and accept them in the ER. I've never worked so hard in my life there. And it was like in trying to make sure everybody is safe, because now you've got really new people. So that I can understand you're picking up 4 patients that should be housed elsewhere.
Well, and it's getting orders because if they're waiting for admission, so the hospitalist has not seen this patient yet. The ER docs are new coming on shift. They never met you. They're getting a story from an emergency room doctor because you're waiting for admission. But I'm only going to give you a quick little blurb because I've already told the admission doctor all about that patient. Except now nobody owns you. I come on as your nurse and you have a fever. I now have my emergency room doctor's never met you, doesn't know if they can order Tylenol. The doctor who saw you has left, and the one that knew about you has reported off to another doctor who hasn't met you yet.
Yeah, it's for people don't understand what you're going through.
Yeah.
And that takes a lot of time, a lot of energy, and a lot of knowledge.
Well, and I don't mind that, but the safety for the patient. Where's the safety net for that patient when
Right.
I'm in an emergency room and a new sick patient comes in and now I don't have time to address any of that with you?
Right. Where is their safety net?
Exactly. Where's the safety net?
That is unbelievable. but it happens, and that's the way it is.
It does.
So I'm curious, is there anything else that we should talk about before we have another wine and cheese? Anything you want to mention?
I think it's still, as far as a general message out there when seeking healthcare, be kind. We as nurses are still tired. I know the heightened has come down and people feel a little more comfortable navigating their world, but our world is still very much upside down in how we can deliver care. And we're still trying to figure it out to make it a safe, navigatable system.
Well, Amy, I think nurses like you are just wonderful, and you are really taken to think about safety nets for the patients and to be so kind. You are terrific. And I want to thank you for being on the show tonight. And I'd like to thank Lillian Caldwell again and Jeannie White for the Passionate World Talk Radio. And so until next time, should we sign off?
Sounds good.
Thank you.
Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon Alexa, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook Live, LinkedIn, and all the other podcast directories one can find on the internet.